one of the things I love about modeling is it's a great tool that helps us conceptualize what an epidemic or a pandemic might really look like. So we build visualizations that show people how disease spreads across the country or throughout the country or even throughout the world. And those visualizations almost always, when we show them to people, get the same reaction, which is, oh, so that's how it works. And, I have the same feeling when I look at the model of a hemoglobin molecule, for example. And all of a sudden, I see it. And I see why it does what it does. I see how it works. And the same is true when we build these infectious disease models. They just really help us understand things much better. And finally, what I love about modeling is it allows us to do experiments that we couldn't do on human populations. Every outbreak is unique. There are no two that are exactly alike. Even two flu outbreaks are not identical because a lot of things change from one place to another. So we can, in the computer, run a pandemic many, many, many times under the same circumstances and see what happens. That ability to do experiments in a computer that we could never do, would be totally unethical to even think about doing them in a human population, gives us a lot of power. It's a wonderful tool. Well, you think about all of the tools you have in your arsenal. We have antiviral drugs that help you once you've gotten sick. We have vaccines that can protect you from getting the disease in the first place. And fortunately, we now have an H1N1 vaccine. We have what we call a lot of social distancing measures. Things like staying home when you're sick, isolating yourself from your family if you're sick so that you're not spreading it to your loved ones. We have tools for distributing drugs easily in this country. You can, in most places, you can, if you get sick, you can call your doctor and call a prescription into the pharmacy and have it within a few hours. So we have lots of those resources. And then the question really becomes, how do you deploy those resources to protect the most people? One of the most useful tools for studying the dynamics of infectious diseases now is computational modeling or analytical modeling of one sort or another. In computational modeling, we use all sorts of computers, from desktops to giant supercomputer centers, to computationally figure out, to model a population, to create a synthetic population, as it were. And then we let diseases spread on that population. We see what happens under various circumstances. So we might, for example, we can get a pretty good representation of the United States population. We know where the cities are, we know how people go to work, we know how they move from home to school to activities and back home again every day. So we have that kind of information for the United States. We can take that information and start an epidemic in some place and see how it spreads. Once we know how an epidemic would spread in the United States, we can then begin to look at different strategies for controlling it. What would happen, for example, if we closed schools for 2 weeks? What would happen if Chicago closed its schools, or Texas closed its schools and other places didn't? What would happen if we had a limited amount of vaccine? What would be the most effective way to use it to protect people the most? So we can do experiments to look at all of those different characteristics of an outbreak and provide that information to people who make decisions about strategies for protecting the people. The results of the modeling, I think, increase the ability of our public health system to protect all of us. And that's really important. So it's not that you need to know about the modeling results or that I need to know them, but public health can take account of what the modeling says in order to develop policies that protect us, protect our children, protect our businesses. We can provide advice and recommendations to people about how they can behave to protect themselves and their families. If I were to say that there's anything that needs to happen in order for modeling to really improve, it would be the availability of information. So being able to integrate information of all sorts that impacts infectious diseases is critical. So we need to know a lot about diseases. We need to know a lot about how people behave. We need to know a lot of data about where a disease starts and how it starts. We need to know about pets and agricultural animals because a lot of these diseases jump from animals to humans and back again. We need to know about migrating birds. We need to know about climate. The ability for scientists to integrate that amount of data and share it with one another in a useful way is a huge challenge. It's a challenge for all of science, and it's certainly a challenge for understanding the dynamics of infectious diseases. There's so much of it. It's a huge amount. If you just think about the amount of genetic information that we have now, it's a huge challenge just to analyze that one kind of data and really understand, for example, how inheritance works. Now we're going to jump up a whole nother level and say not just about genetics, but we're going to add on to that the genes of the microbe plus the genes of all the people in the world plus climate plus evolution plus vaccines plus antivirals plus behavior. All of those things are important to understanding infectious disease dynamics. But it's way more information than we can deal with at this point.